Okay, this is the ultrasound of a 35 years old male. This is the liver, this is liver tissue, this is the middle hepatic vein branching, and now you see this is a echogenic focal vein with internal multiple cystic areas, and the important thing to note is that the posterior wall enhancement is seen. Now its outer border is quite regular, and the internal configuration is consistent with the cystic mass with the posterior wall enhancement or strong back wall. Sorry, measures 4.9 into 4.4 centimeters, and by this view, this is focal lesion of infective nature in healing phase, that is healing phase abscess, that of the right lobe of the liver. Now why? So, other thing that you can report is that we see an approximately measuring 4.4 into 4 centimeter predominantly cystic area with multiple internal echogenic areas scattered within it, giving posterior wall acoustic enhancement in the right lobe of the liver, anterior segment of the right lobe of the liver. Now this is a bit magnified view of the same. No internal calcification is seen, and you know this picture is very much typical of liver abscess in healing phase, and because you see the posterior wall enhancement, almost a regular thin wall, relatively thin wall, and it does not fit into the category of any other focal lesion seen in the liver. So this is how we report about that. And another thing can be that this is a thin walled cystic area filled with echoes, different strength internal echoes can be another explanation for this. And if someone wants to aspirate, we'll have to use a thick needle to get it out. This is all, if I say that this is a cystic area filled with different strength internal echoes, they are thick, so thick that the posterior wall acoustic enhancement, those seen, is not that much as we see in purely cystic areas because of the thick echoes, thick material within this cystic area. Now, if surgeon has to, or you have to do an interventional procedure to remove the internal pus or the material which it contains, then you will have to need a wide bore needle. If you report like this, it becomes easy for the surgeon to go for which bore needle of which bore, and so that you can easily remove this material. If it is absolutely thin or the echoes are of low level, then the needle will be different, of different bore. So this is a good information for the surgeon, or if you yourself want to get rid of this cystic area. So this is an abscess of the liver in healing phase, because the patient has been on antibiotics for at least 1 month with flagyl. So now this is the kidney. It does not relate to the kidney. Kidney is okay. Ek lamba saal hai zor di. Zor di saalo. This is the gallbladder. Gallbladder is okay. You can see that this is the gallbladder. This is the portal vein, and there is no fluid above the diaphragm. Sidhe ho jao. And the another thing to note in all such cases is to see the para-aortic region. If there is any para-aortic adenopathy, this is the aorta, this is perimesenteric artery, portal vein, this is the head of the pancreas. So there is, and the another thing that you will report is that there is no evidence of any satellite lesion or any other lesion seen in the liver except this solitary, well demarcated cystic lesion filled with different strength internal echoes along with it. It will be better if we also see the spleen because in systemic infections the spleen will be enlarged, but in this case the spleen measures only 12.3, up to 12 is normal, so this is in fact a case that is not that is not complicated by other findings. See if there is any fluid in the dependent region, peritoneal cavity, any ascites associated with it should be seen. There is no ascites seen in any other scannable potential abdominal spaces. So this is our case of the day. Thank you very much.